Chapter 5 is the principles of bonding. What is bonding? First, to achieve bonding, the surface of the tooth must be prepared, or the surface of the restoration that we're trying to bond to. In order to prepare the surface of a tooth or a restoration, first of all, on a tooth, we would need to remove decay, plaque, and debris, and if it were bonding to a restoration, the plaque and debris would need to be removed. We would etch the enamel or dentin, or both, with either a 10 to 38% solution of phosphoric acid. Phosphoric acid comes in a range of different strengths, so it would be based upon the application as to which etch we would use. That etching process removes microns of both the tooth to provide a rough surface to which bonding of the dental material can occur. What is the best method for preparing the tooth or restoration for bonding? And the best method is to use a slurry of pumice and water applied with a bristle brush or a rubber cup. You want to avoid using prophy paste or anything that contains fluoride or oils or anything else that could affect that bond. If we use our little preppies that are found back in our clinic, they are just pumice and water. They don't have anything in them that would affect the bond. So you want to make sure you're either mixing up some pumice and water, or you have those pre-measured little individual size preppies. So if we're going to bond to that etched surface, the resin bonding agent or primer is first flowed over the surface after it is etched effectively, and it will penetrate those microscopic pores that have been created by that etching process. When bonding agent cures, it will form these little resin tags that adhere to that etched surface of the tooth. So we're going to put this bonding agent over the etch, and we're going to cure that, and it creates these little finger-like projections or resin tags that grab a hold of that etched surface. And then that will allow that bonding agent to chemically bond to any resins that we then place on top of that, such as composite resin. We've talked about wetting in previous chapters. So what etching does, it increases the ability of the bonding material to wet the tooth surface by creating a high surface energy. So if you remember, a low wettability, an example that we gave for that is a freshly waxed car is nice and smooth, and the water will just bead up on that surface. So when we etch it, it kind of roughens up the surface or makes it a more high surface energy. So as you can see in the image lettered A, the material will spread out over that surface. So good wetting increases the contact of the material, and poor wetting would prevent complete contact. Bond strength is determined by the amount of force that is necessary to break the two materials apart. So if once they're bonded together, if they're easily broken, that would be a weak bond. We don't want that. We want a nice, solid, strong bond between our two materials. An enamel bond is typically stronger than a dentinal bond. So it's typically easier and more effective if we're bonding to enamel, but many times in a larger, deeper area of decay or a restoration, such as a crown or something of that sort, we're bonding to dentin. So dentin is a little bit more challenging to bond to. So the durability of the bond is how long that bond will last, and we're hoping that it lasts for a long time. So we'll talk about enamel etching first. And what we're doing when we're etching our enamel is we're removing a very small portion of the surface of that enamel. This reduces the enamel rods and opens those porosities between the enamel rods. We're also removing the smear layer. The smear layer is composed of any debris that could have been created from cutting the tooth. Bacteria, saliva, blood, anything in the mouth that could be a contaminant on that surface is considered the smear layer. Etching removes that. Etching times are different based on the teeth, and you always want to follow manufacturer's instructions for the specific etch that you're using as well. So suggested times of etch for permanent teeth is anywhere from 20 to 30 seconds. If a tooth is highly mineralized, you may need to etch it longer for 60 seconds. Primary teeth, due to their aprismatic structure on that outer layer of their enamel, we need to typically etch longer. So 60 seconds for primary teeth as well. In this image, you can see the dentinal tubule, and it is plugged with that smear layer, which is any contaminant, bacteria, blood, tooth cut, dust from the tooth being prepared. So when we etch, we're getting rid of all of that so that that bonding agent can kind of attach their resin tags down into those openings in the tooth and create a nice bond. When a tooth is effectively etched, and we're talking about enamel etch, it's going to look frosty. You're going to dry it with air and it's going to look very frosty. I don't know if you've ever seen like etched glass, how it looks white and frosty where it's been etched. It's very similar to that with tooth. If you don't see that when you dry the tooth probably needs to be re-etched. If you're etching enamel, or I'm sorry, if you're etching dentin, it's a little bit different. In dentin, we want to leave it moist and glistening. So when you dry that with air, and you don't want to over dry dentin, you just dry it lightly, and then you want to leave it slightly moist and glistening. And when you're etching both enamel and dentin, the prep is left slightly moist for wet dentin bonding, and then the frosty appearance of the enamel can't be determined if you're etching both surfaces. Etch is typically supplied as a liquid or as a gel. The gel is a little bit safer to use on the tooth, but when you are rinsing that gel, you need to have a high vac suction right next to it so that that dollop of gel does not get, when you go to blow air on it and water to rinse, you don't want that to fly into the patient's throat, because those etching materials can cause a chemical burn to the oral soft tissue. So you want to be really careful to use high speed vacuum so that you can quickly evacuate their mouth from the gels and liquids. The liquids, typically we would use little cotton pellets on cotton pliers, and we would dip into the liquid. You could also use micro brushes. You just want to make sure with the liquid that you don't drop any on the lips or the buccal mucosa as you're bringing it in and out of the mouth. Now, rinsing times are different. Acid gels is about 10 seconds longer, and liquid etchants can be shorter. So if you're using a gel, it takes a little bit longer to rinse that. The liquids you can rinse for 5 to 10 seconds, gels 10 seconds or longer. This is what a tooth looks like if it's been etched effectively. And you can see there's some really deep grooves in these teeth. Those would be good candidates for sealants because those grooves are not well coalesced. They're deep and they're likely to attract plaque and bacteria and could possibly lead to occlusal decay. So many times it's a tooth that looks very similar to this that we would be putting sealants in. So as far as the dentin etching, dentin has a higher water content. It's got more of an organic makeup and contains collagen and fluids from the pulp chamber. So when etching dentin, we still would like to remove that smear layer, which is the same as it is for enamel. It's the debris from the cutting or preparation of the tooth structure. It also can contain plaque, bacteria, pellicle, anything in the saliva, blood, and tooth dust. All of this must be removed for effective bonding to be performed. It sticks these smear layers stick tenaciously to the surface. They plug the openings of those dentinal tubules, and it can't be washed off with just water. So that's where we're going to etch, and that will remove that layer. Bonding agents are, after we've etched, that's what we're going to use, just like we did with enamel. We're going to use acidic primers to etch, which will penetrate the smear layer, and then we're going to place our bonding agents. And in this case, no rinsing is used with this particular system. If you look at the left, you can see the dentin. And then if we blow it up microscopically, what you're looking at are the dentinal tubules that run through the dentin. Many of our desensitizing toothpaste and things like that will actually cause occlusion of these dentinal tubules so that the cold or hot stimulus is not allowed to travel through those tubules directly to the nerve or the pulp chamber of the tooth. With dentin, we use phosphoric acid etch. This will expose that meshwork of collagen fibrils and open those dentinal tubules that I was just showing you. Due to the lower mineral content, dentin only requires about a 10-second etch. So we don't need to etch dentin quite as long as we do enamel. The excess water is removed by a gentle stream of air, whereas with enamel, we want to dry it thoroughly. With dentin, we just want to use a gentle stream of air and leave that surface moist so that those collagen fibrils stay what they call fluffed up and we don't desiccate or over dry the surface. Here is Etched Dentin. You can see that this has been gently dried and it still looks wet, or not moist, let's say. That's the word that so many people don't like, but it's the only word that really describes how we want that to look. So enamel bonding systems, when resin is cured by a chemical process or by light activation, it locks into the microscopic spaces and irregularities, producing those resin tags. So you can see these finger-like projections, and then we put on, when you look at C, you can see the bonding resin has been placed over top and how it has wrapped itself down into those little projections. And those resin tags are what secure the resin into place, and that will create an incredibly strong bond. With bonding of dentin, there's a resin primer that is used that penetrates the etched dentin or enamel, and it's a solvent. And then there's an adhesive resin that's applied over that primer. The primer is placed first and it's dried before curing to remove the solvent and any remaining water. And then we can do what we call wet dentin bonding, where the minerals are removed through acid etching and fibrils of the collagen matrix are exposed. We want to keep those fibrils wet and allow them to stay spread out. If they dry out, they collapse, and that will prevent the resin from bonding to that etched dentin. So that's why we don't want to over dry them, because we want those fibrils, those collagen fibrils, to stay spread out so that the bonding resin can grab a hold of those little finger-like projections and create a nice bond. Primer is more important on dentin than it is on enamel. I've just supplied for you, you can look through this, the history of bonding systems. So in the first generation, back in the 1970s, there were enamel bonding agents introduced. And then they came out, in the 80s with enamel and dentin bonding agents, along with light curing. And as we proceed on, we improve upon that formula each decade. In the fourth and fifth generation in the early 90s, total etch was made available, and that was with phosphoric acid. There was a 2-bottle system, and then they went down to a 1-bottle system where etch and primer were combined. And then in the late 90s, self-etching systems became available, which the primer etched and primed. There was no acid required. And it's just gotten better and better. Some of the systems you don't have to rinse anymore. Some of them are just a one-step system. Many of them are dual cured, so that they are not only chemically cured, but they're also light cured, which are great for any applications where it might be difficult to get a good light cure. So under veneers or under orthodontic brackets, or if you're bonding a crown with resin to the tooth, all of those are examples where the light may not be able to penetrate the entire surface of that bonding resin. These are just some different brands and different looks that you may see out there. The one here, the OptiBond, has two components and the applicator to dispense that. The one over here to the right has the primer and the bond all in the one little pin there. So what three things do all bonding systems have in common? You must etch for all bonding. They may have a Dentin primer and a bonding resin. What is total etch? Total etch is a bonding system that requires to be etched and then rinsed. So this will include etching of both enamel and dentin as a separate step from the application of the actual bonding agent. Self-etch does not use a separate etching procedure. The acid that etches the tooth is also in the resin primer, so there's no rinsing needed. You etch and prime all in the same step. Then there are some universal adhesives. These are very versatile. Most can be used with etch and rinse, self-etch, and selective enamel etch techniques. They use a phosphate ester that allows them to bond to the tooth structure. It allows them to bond to ceramics as well as metals. Hybrid layer is a combination of dentin components and resin. These are formed by intermixing dentin bonding resin with collagen fibrils and the etched dentin surface. This layer will facilitate the bonding of composite resin to tooth through a chemical resin to resin bond. And in your book, you can see, I believe it's figure 511 will show you an example of this hybrid layer. There's different modes of cure with bonding. The mode of cure depends on the type of restorative materials you're using. So there's three different modes of cure. It can either be light cured with our blue light. It can be self-curing where it's more of a chemical reaction that's occurring, causing that bonding material to cure, or a combination of both, as we spoke of just a little bit ago. We've talked about microleakage and the basic definition of microleakage. So what happens with this is there are margins where your restoration meets the tooth. And if a lot of times it's due to percolation of the tooth, where it expands and contracts due to thermal changes. Those restorations can then leak when they're not completely sealed at the margins. Something else that could lead to microleakage is if when the bonding was placed, the doctor placed that resin in really large increments that they allowed for too much shrinkage, and it wasn't placed properly to start with. So that could be a cause of microleakage. Microleakage can then lead to recurrent decay, which can lead to failure of the restoration. And like I said, one of the big causes of microleakage is that percolation, which is just the expansion and contraction due to temperature variations. And when that happens, it allows fluids and bacteria to percolate or flow in and out of those openings next to the restoration between the tooth and restoration. And you can see in this image where microleakage has occurred. Common contaminants are the saliva and blood in our mouth. Prevention of contamination requires very good isolation with cotton rolls, possibly parotid pads. The doctors, when they're doing preparations, will use those astringents and hemostatic agents we talked about in our impression chapter, in chapter 15. and those are agents that we can place around the tooth to stop bleeding so that they don't contaminate our restoration. If contamination of a newly etched surface occurs, we are going to need to rinse it thoroughly and then re-etch that surface for 10 to 15 seconds. So if you know that you were unable, and this happens many times when we're doing sealants on kiddos, their saliva really likes to flow like a fountain, and so sometimes it's very hard, unless you have an assistant helping you with suction, to keep the field super dry. And if you know that you have contaminated that surface with saliva, just go ahead and re-etch, or if you even think there's a possibility you have, let's re-etch, because otherwise you could place a sealant and it could leak, and the patient could end up with decay underneath that sealant if it's not got a nice seal. So we always want to make sure that we've got a nice etched surface when we dry it. If it's enamel, we want it to be really frosty, and that's what we should be dealing with when we're placing sealants, is that enamel frosty etched look. Like I said, materials that prevent good bonding are eugenol. You don't ever want to use eugenol, which is often found in that temp bond. So if you are placing a temporary crown in weight of a porcelain crown or a PFM that you plan on bonding to that tooth with resin, you're going to want to use a temporary cement that does not contain eugenol, because that will affect the bond of the resin bonding that you desire when the final crown is put to place. Different flavoring oils and prophy paste can affect the bond. So in a kiddo that you're wanting to do sealants on, you want to think about this and make sure that you haven't polished or placed fluoride prior to prepping those teeth for sealants. That would be the last thing you would do after sealants are placed. And then carbamide or hydrogen peroxide can also prevent good bonding. So we would want to make sure the patient hasn't just bleached their teeth with either one of those components. Postoperative sensitivity is something that we unfortunately deal with a lot. So it can be of short duration. It usually is. Some patients may experience this transient tooth sensitivity right after a tooth has had a bonded restoration. Usually this will last only a short time, maybe hours or even up to a few days. So it's always a good idea to get back with your patient and find out from them if that sensitivity is lessening or if it's continuing or worsening. So that's a really important thing to follow up with. Some of the common causes for this tooth hypersensitivity would include during the prep for that bonded restoration, the tooth possibly was over dried, and this would be a problem with dentin etching. So we've desiccated and over dried the dentin, which traps air in those dentinal tubules, which can lead to hypersensitivity. If the dentin is over etched, like we etched it too long and then it wasn't adequately sealed with priming or bonding agents, that can be painful. If the increments of that resin are cured in too large of portions, that can cause microleakage, which can lead to postoperative sensitivity. And we see less post-op sensitivity with self-etching bonding systems where the primer and etch and everything are in one step than we do with the total etch. So prevention for post-op sensitivity is found with, like I said, the self-etching bonding systems. It is also important to carefully follow each of your manufacturer's instructions for use to ensure that those dentinal tubules are sealed properly so that we can avoid as much post-op sensitivity as possible. So some of the clinical applications for bonding. We can bond a restoration, which would be after the initial resin is cured. Other adhesive bonding resins or resin cements can be used to attach restorations to that restoration using resin to resin chemical bond. Ceramic bonding and repair. So let's say that we have a ceramic crown. We can bond material to that ceramic restoration. This is retained better if it is bonded to the tooth rather than merely just cemented. So if we bond it, it's going to last better than if we just cement it to the tooth. That chipped ceramic may be bonded if the repair is not in an area that's going to be placed under a heavy load. If it's going to be placed under a heavy load, chances are it could fracture. Metal bonding this bonding creates a better retention of the metal to the tooth. So sometimes we use resin bonding when we are bonding a metal crown. So this could also be used for the placement of composite veneers over metal. And then amalgam bonding would be if we were going to place resin underneath an amalgam, and that is rarely done because it has not been proven to improve the retention of that amalgam. So one thing to remember when we're talking about all of this, when we're talking about bonding, if you talk about a composite resin filling, we're really talking about the same material. Resin can be used as a cement, and it happens to be the strongest and the least soluble cement we have out there. We're going to talk about cements and their applications in Chapter 14, but when we're talking about bonding in these chapters, we're talking about sealants, we're talking about using that resin to bond to maybe a fractured ceramic crown. We're talking about veneers to a metal structure. We are talking about fillings and how they should only be 1 to 2 millimeters of material bonded to itself. And if you keep a nice dry field, you can just keep adding to that until that area where there was decay is filled. You don't want to place those increments too large, or it can cause microleakage and possibly restoration failure. Composite resin repair. So let's say that you have a composite filling and it has broken part of it. Sometimes that can be repaired. However, if it's an older composite, it may not bond well. It may produce more of a weak bond with the new composite material, so sometimes you're farther ahead to just replace the whole composite. The bad thing with that is every time we replace a filling, whether it be a composite amalgam, redo a crown, every single time requires you to put the tooth through the trauma of preparation. So there's always going to be a little bit of tooth structure removed. So if you could bond to the previous composite, you're going to save that trauma on the tooth. Ortho bracket bonding is another use of this, ceramic veneers, as well as those endodontic posts that we've talked about in radiography. So if a tooth has had a root canal and there's not a lot of tooth structure left, they will take an endodontic post, which is typically titanium metal, and they're going to put it down in the canal, the pulp chamber. That is bonded into place typically with this resin bonding. So that's another application for this. In summary, bonding has a wide variety of uses in the modern dental practice. Bonding systems are typically placed into 2 general categories: the total etch, which requires that rinse after we etch, and the self-etch has no rinse. It usually has the primer and etch all in one step and does not require that rinse step. We should always pay careful attention to our manufacturer's recommendations in order to get the best result that we can with our bonding system.